Obsessive-Compulsive Personality Disorder (OCPD) is a mental health condition characterized by a persistent pattern of perfectionism, rigidity, and control that interferes with daily functioning and relationships. People with OCPD have a strong need for order and control, and they tend to become preoccupied with details, rules, and schedules. This behavior can cause significant distress and impaired functioning in relationships, work, and social activities. The exact cause of OCPD is not well understood, but it is believed to be a combination of genetic, environmental, and psychological factors. There is evidence that OCPD has a higher incidence in close relatives, suggesting a genetic predisposition. On the other hand, childhood experiences, such as overly strict or demanding parents, can also play a role in the development of OCPD. People with OCPD display a range of symptoms that are often associated with this disorder. These include a persistent need for order and control, a preoccupation with details, rules, and schedules, a tendency to become overly absorbed in work or hobbies, a rigid adherence to moral and ethical principles, and a reluctance to delegate tasks or relinquish control. They also tend to be inflexible and have difficulty adapting to changes in their routines or plans. To be diagnosed with OCPD, an individual must meet specific criteria as outlined in the DSM-5, Diagnostic and Statistical Manual of Mental Disorders, 5th edition. The criteria include an enduring pattern of perfectionism, rigidity, and control that leads to significant distress and/or impaired functioning. The individual must also have a tendency to become overly involved in work or hobbies, a reluctance to delegate tasks, and a tendency to hoard possessions. Treatment for OCPD typically involves psychotherapy, such as cognitive behavioral therapy or psychodynamic therapy. During therapy, individuals with OCPD can learn to understand and manage their thoughts, feelings, and behaviors, as well as develop new coping strategies to manage their symptoms. Medications may also be prescribed to manage symptoms of anxiety or depression that may be associated with OCPD. Obsessive-compulsive personality disorder is a complex and challenging mental health condition that can cause significant distress and impaired functioning in many areas of life. People with OCPD have a strong need for order and control, which can cause problems in relationships and other areas of life. With appropriate treatment, individuals with OCPD can learn to manage their symptoms and improve their overall functioning.